On today's episode of Talk Legal to Me, we have my personal friend, Dr. Vartevan. She is the radiologist who owns Camelback Radiology and Camelback Imaging. Not only is she a physician, a business owner, she's also a mom. We're going to talk about medicine. We're going to talk about her lead into personal injury and how she balances motherhood with everything else that she's doing. Stay tuned. All right. Well, welcome to Talk Legal to Me, Dr. Vartevan.
Hi, thanks for having me.
Thanks for coming.
Of course.
Tell us, you're a radiologist.
Yep.
Tell us how you got into that profession.
So after you do your 4 years of med school, you get to choose what kind of specialty you want to go into. And so that's when people decide if they want to be a pediatrician, a surgeon. I looked at radiology actually at third year of med school because I really liked the technology. I really liked solving puzzles. But then I was like, I'm not sure if this is the right fit for me. All medical personalities have radiologists are not known to be outgoing, I'll say it that way. And so I was like, maybe this isn't the right fit for me. So then I looked at other specialties like emergency medicine, and I was like, this is not the right fit for me. That is like, adrenaline junkie type people. And so I kind of went back to radiology and decided on that and did my 5-year radiology residency. And it's the best decision I've ever made, actually.
That's awesome.
Yeah.
You seem like you really love what you do. You're great at what you do.
Well, thank you. And I do love it.
Yeah, that is awesome. I love when people find their calling, and I feel like you found yours. And aside from just, obviously you're a physician, but you also own your own business.
I do. That's right. Yep.
Talk about that a little bit.
Yeah, so I have a teleradiology company and an imaging company. So my teleradiology company is called Camelback Radiology, and I started that in 2020. Great timing, right? Right before the pandemic.
Yeah.
And it kind of came out of necessity. I was working for another radiologist at the time, and we came up on contract renewal and just didn't really see eye to eye. And so I was kind of thrown into starting my own practice. I wasn't planning on it. And then it just kind of took off. I mean, slow in the beginning, as you know. Anytime that you start a business, you're twiddling your thumbs because you're used to going a million miles a minute.
Right.
And then it grew, and then it got to the point that I needed to start bringing people on to help because we had so much work to do. And now we're up to, including myself, 9 radiologists, and it's very busy, and it's going really well. Yeah.
That's awesome.
Yeah, thank you.
Boss moves. I feel like sometimes when a door closes, another one opens.
It's so true. I mean, there's been so many times in my especially business life that I've done things as a result of something else. Like, it wasn't necessarily a plan, but it was kind of a pivot. You're like, okay, well, I thought we were going to go to the left, but clearly that's not going to work, and so now we gotta go to the right and make it work.
That's absolutely true. I can definitely attest to that. Owning my own business, you got to go with the flow.
You do.
And go along for that ride.
Yep, you do.
And so, what has been the most challenging part of owning your own business, would you say?
The beginning. So now things are going, it's still very busy, but things are going well. But the first, 6 months to a year, I would say, when you're used to making, I'm going to call it your big girl salary, and going back to making like almost no money because you're starting from scratch is really scary. And one of the things that kind of gave me a little peace of mind was like, okay, well, if this fails, I can still go be a neuroradiologist and work for someone. It's not, this is worth the effort to try to accomplish. But it's the beginning. Like, you go from just, working 8 to 10 hours a day, and you're just very busy, to almost working like 1 to 2 because you just don't have the work yet. And so you're just scouring the internet and trying to build your business and seeing what you can do to make yourself unique and special and provide the best work you can to grow. So the beginning was really scary. And then there was a tipping point where I had too much work for one person. But I didn't quite have enough work for a full-time person. And luckily, my best friend, who still works for the company to this day, was like, I have some extra time, and she's a radiologist, and she's like, well, I can just take on a little bit just to ease your load a little bit. And so she came on, which was a game changer. Like, just having an extra hour of her working rather than me was incredible. Wow. And then I know you can attest to this too, but I think the first 3 years of my company, I never took a day off. Like, I never took a vacation. Like, maybe it was even longer than 3 years, but if I was out of town, I had my full workstation and I was still reading for a few hours every single day. It was just in a different location, you know? And so that growth phase, like going from nothing to very busy, is wonderful, and it's exciting, and it's like an adrenaline rush, but it's exhausting at the same time.
Yeah, for sure.
Yeah.
Well, I'm glad you were able to figure out a way to kind of, that's the hardest part, is like that growth in a business.
It's so hard.
Where you're not big enough, like you said, to maybe like take on all these employees, but like you're drowning almost essentially as a business owner. So like finding that piece that worked for you to kind of get you to the other side is essential, you know?
Well, and like, you wear so many hats.
Oh, yeah.
Like, you're an attorney, but you're also the boss.
Right.
And so you've got your payroll, you've got your marketing, you've got to actually practice law, and I have to actually practice medicine, and then you've got personalities to deal with, because it's not everybody's like super easygoing and laid back that you work with, of course. And and so that's the challenge. And I remember there was another point, I think I was probably about a year and a half, maybe close to 2 years into my company, and one of the radiologists who used to work for the same person that I used to work for before I started my company called me. And he's like, hey, things aren't going so well. And he's like, could you hire me? Because we kind of kept in touch for the past few years. And I was like, I'm like, I don't know if in my head, I was like, I don't really know if I can. I'm like, but I'll make it work. And I was like, even if I'm like just giving him all of my work and I'm not making as much money, like he was just a really good radiologist and a good human being. And I'm like, I want him on my team, and I'm going to figure out how to do it.
That's great. Yeah, and you do just figure it out.
You do
I feel like
figure it out.
as a business owner, sometimes you do get those opportunities presented and you might not be quite ready for them.
So true.
But it's like if you don't take advantage of it and jump on it, then all of a sudden you can lose it.
I know.
You'll find a way.
I know. And it's all about having the right people, as you know.
Sure.
And so it's like, a lot of times you can train, a lot of my admin staff, they're didn't
great.
necessarily come with their own skill set, but they're really good people. They're high integrity, they are honest, they connect with patients really, really well. And so if you can surround yourself with those good people, you're going to do great.
Yeah, that's really important. I feel like, just like you said, you can always train someone to do the job. Yeah. But like the personalities have to mesh. I always say on our team, if they don't pass the vibe check.
I know, it's such a vibe check.
They're
it's
not
so true.
on.
It's so true. Yeah. Even with professionals.
When you're hiring someone, do you kind of like let the team weigh in on if they're liking a person's personality or?
I will say kind of yes and no. So, there's myself and 8 other radiologists. So if there's a radiologist that I want to bring on, I always kind of gauge it first and see what I think. And and it's not to anybody's fault, but sometimes, people, when they're just in that beginning stage of applying or interested in a new job, they may not know. It's almost like dating. Like they just don't know how to play the game right. And so some people, like, I'll just start engaging with them and they're like, oh, I'm interested. I'm like, oh, send me an email. And on the first email with their CV, they're like, hey, I need this vacation, I need this and that. And you're like, we're a team. Like, and it almost like sometimes, and it's probably well-meaning, and they're probably saying, hey, these are my requirements. If this doesn't work, then it doesn't work. But, you kind of have to take it slow to make sure that there's a good chemistry there. So usually I'll have a phone call with someone. I'll tell them about the practice. I'll hear about what they're looking for, because I want to make sure that we mesh well, align. And then I will usually introduce them to all the radiologists that's in the company, because I want to make sure whoever comes on, like I'm very much like a under promiser, over deliverer. Like I want to make sure that they come on and they are like, they're so excited about being on the team and they never want to leave, because there's so much training that goes into bringing on a new radiologist, as you know, anytime you bring someone on. So I want to make sure they stick. So most of the time I'll put them in touch with all the other radiologists. They'll usually call someone. That radiologist will tell me, they're like, oh, hey, I talked to Dr. X, and they seem really interested. They were really nice. And so usually my team will give me an idea of what they think. And then with my admin staff, and I think you know this, but maybe not, 4 of them are sisters.
Yeah, I love that.
So,
it's
so they get along really, really well. And then one of my other admin, she's actually the sister of one of my very good friends who's a radiologist. So the 5 of my admin team that kind of run everything behind the scenes, they mesh so well. Like,
That's
they
great.
have each other's back. They're very supportive. Like, it's just amazing. Like, everybody jumps in to just make sure the work gets done. It gets done well.
Right.
And it's important to have that, because a bad apple can really just throw everything out of whack.
I'm such a believer of that.
Yeah.
I feel like it is so important to make sure everyone just works in a cohesive team.
So true.
And that people you can trust. So
Yes,
like
absolutely.
you said, having the siblings that, they all are going to have the expectation that each other pulls their weight and they're going to be accountable to one another. Like, that's very important.
Exactly.
So
Yeah. And they can be
smooth.
genuine and honest with each other too. Like,
Sure.
and of course they're siblings. So I'm sure there might be a little bit of less of that political, talk with each other, but they're honest with each other. They don't feel like they have to not say what's really going on, or they don't have to say, hey, you really need to take care of this. So it's been really great.
That's awesome.
Yeah.
Well, I mean, that is such a jump from 2020 to now to having 9 radiologists is so impressive.
Oh, thank you. Yeah, it's been a whirlwind.
And you read so much in the PI community. How did you get into the PI community? Because I feel like a lot of doctors either don't know about the PI community or they don't want to be a part of it. How did you even learn about it and know you wanted to do that?
It was by chance, actually. So when I was in my fellowship, I did my fellowship in Phoenix at Barrow Neurological Institute. I was looking at 3 different jobs. I was looking at a very traditional job, which would have been in the hospital, doing some neuroradiology, because that is my specialty, and then some what we call general radiology, so reading chest x-rays and CAT scans of the abdomen and pelvis and things from the ER. I thought about doing 1 more year at Phoenix Children's Hospital to do pediatric neuroradiology, because it's a great hospital, great institution. But I was worried that I would be very, kind of pigeonholed. Like, if I ever didn't want to stay in Phoenix, I'd have to go to another pediatric hospital. So I felt that was a little bit limiting. And then the person I ended up working for kind of knew him through other people, and he had a private practice, and he needed a radiologist, and he happened to do PI. And I had no idea about anything in the personal injury world. And it has a stigma. So I wouldn't say it's something that I was like, when I took the job, I was 100% unaware about it. And then, of course, after reading a few cases, I was like, all of these patients have been in a trauma. And then I started to learn a little bit about it.
Sure.
And then when I started my own company, then I learned a lot about it. And I really actually love it. I love it because there's not the typical constraints that you have with the way medicine is now being practiced. For example, you and I know a wonderful podiatrist in town. So in a traditional hospital setting or outpatient practice, if this wonderful podiatrist says this person needs an MRI of the foot, I'm worried about an infection, for example, they have to jump through all of these hoops to get that MRI of the foot, even though they know it's right for the patient knows that they need it. They may have to do something called a peer-to-peer just to get it approved to have that MRI done. And it's terrible, and it delays care. In our personal injury little community, it's not that way. So people or physicians are able to practice to the scope of their ability, which is the way it should be. So if you are hurt and they're worried about a disc problem, say you have something called acute onset of radiculopathy, meaning you have pain in your neck going down your arms and they're worried about it, there's no hoops. You go ahead and you get the imaging that you need done. So for us, I really, really have grown to love that. The other thing I really love about personal injury, and I'm always trying to get more physicians involved in it, is a lot of these patients are very scared.
Yes.
They are hurt. They don't really know what to do. They're told to follow up with their primary care physician. Their primary care physician doesn't know what to do. And I mean, these are patients, and we're doctors. That's what we got into this field, is to take care of people. And so I feel like the more high-integrity, specialty-trained physicians that we have in this world, the better treatment these patients are going to get, because all patients deserve the best treatment. So I've really grown to love it in that sense, because I really want to elevate the care that people are getting.
Yes, I think you're so right about the stigma.
Yeah, there's a huge stigma
associated with it. Like, I've talked to other physicians about it, and they're like, I'd never do PI.
Yeah.
That's kind of beneath me. And I even thought that, too, when I was an assistant attorney general. I was like, I don't want to transition into this field, because I felt like the way PI was marketed was, so slimy and just looked like it was out for getting a person a settlement, and it wasn't about the care. And then once I got into it, like you, I saw there was such a different side that is unspoken and not marketed that way, about caring about that patient, getting the care and treatment they need. getting
and
them
you
better.
can customize your practice how you want it, because
Right.
you and I know there are still the people that are opportunistic and preying on these patients that have been injured.
For sure.
But we don't have to practice that way. We can
Yeah.
practice the way that we think is best, and we can make sure that we're meeting standard of care, if not exceeding it, and really making sure people are getting the right treatment.
Right. That's awesome. I'm happy that you are a physician who's decided to go into PI, because, I mean, your reads are great. They're accurate. They're on point, and really patient-centered without caring about all the outside noise.
Totally.
Like you said. So what's one of the cases that you can recall that is so memorable to you that you've read before?
You know, we've had so many interesting cases, but we have one that we're actually writing up. I'm writing it up with a radiology resident that's in Miami, just because it's very unique. It was a patient that sneezed and had back pain, right? And so I open up the case, and they had this big mass or tumor on the end of their spinal cord, and it had bled. And so it was very, very messy looking. And, you know, when we read a case, we often give something called a differential diagnosis, saying, hey, here are the findings. My opinion is that it could be this, this, or this. And we try to always give 3. And so I read the case. I gave my 3 differential diagnosis based on that location and what you commonly see there. And I said that there was hemorrhage, because, you know, blood will make everything look very distorted when you're reading the picture. It's not this, you know, pretty picture you're seeing. And so I happen to know the referring doctor that ordered the case. I was like, hey, this is what's going on. They need to see a spine surgeon. And so they're like, okay, they sent him over to the spine surgeon. I'm like, hey, please keep me in the loop. I want to know what this is. Because anytime we have a tumor or a case like that, we want to know the pathology, because you want to see if you were not right in a like, oh, I was right way, but for your own knowledge, to make sure that you can treat the next patient better. And so I had been following up with the case, and he's like, okay, the patient went into surgery. This was the surgeon. And he's like, got the pathology back. And the pathology was totally not anything that I would have expected. So, you know, you have certain cells everywhere in your body, and those cells can sometimes, you know, develop into cancer. And this part was in the spinal cord. And so there's just a certain number of cells, or certain type of cells that are in the spinal cord that usually can develop into cancer. Well, this person had something called a Ewing sarcoma, which is usually a cancer that arises from bone, not from soft tissue. And if it goes into soft tissue, it usually is coming from the bone. And so it was very, very unusual. They got a PET scan, so they kind of scanned the entire body to see if it was what we would call a metastasis. So did it start from, like, you know, the hip and then metastasize to the spinal cord? Because that would make sense. And they didn't. So it was a Ewing sarcoma that arose from the distal part of the cord, or the bottom part of the cord. There was no metastatic disease, which is great. The patient is doing great. I think they're in remission now. But when I did kind of a quick lit search on it, I think there was maybe one other published case ever on it. So we're writing up the case, and just to, again, it's one of those things that it's like, you know, you got to keep your differential diagnosis very broad, or keep your mind open when you're looking at these cases, because, you know, there's a saying in medicine that patients don't read the textbooks, and it's true, because it's like, hey, no, that shouldn't happen. And it's like, well, it did.
Yeah, it did happen. Now we got to figure out.
Exactly.
So like you said, so you could treat future patients.
Exactly.
And build your knowledge on it.
Exactly.
That is
it was
so
a very interesting one.
Yeah. And thank God they're in remission and everything
they're doing
went
great.
okay.
They're doing great.
Wow.
Yeah. Yes,
and
they had to have
it's
chemo.
It's the sneeze and you get the back pain. I feel like that applies to like 99.9% of the population.
Exactly.
Right? Over 40.
Yeah. Exactly.
Wow. Okay. So something that small.
Yeah.
Jeez.
Yeah. And who knows if it really was the sneeze? You know, sometimes like we're trying to put something together. You're like, well, I did sneeze. You know, you're trying to decide when this all started.
Yeah, you kind of don't know where the onset was.
Exactly.
Wow.
So
amazing.
Yeah. Yeah.
Well, in addition to being a business owner, a doctor, you're also a mother.
I am.
So you're a mother of 2.
Yes.
Talk to me a little bit about how you're balancing motherhood with your professional career, your business.
Yeah, I mean, you know, I think we're all kind of flying by the seat of our pants with that. You know, I would love to say that I've mastered it. There are some like very strong boundaries that I have. So I try to be completely focused on my kids when they're home. We don't have, I mean, they go to school full time. So I drop them off usually around 8:15, and then I pick them up around 4:30 because they have after school care. So during that time is when I try to get all my work done. But in the mornings, like I'm just mom. I'm just trying to make sure I'm making breakfasts and I'm packing snacks and lunches and things like that. And
Right.
Same thing when I pick them up. I try to make sure that I'm like on the way of unwinding, because as you know, sometimes you just get real wound up during the day and you're like, okay, let go of that. I need to move on and be present here. And it's hard, especially when it's your own business, because you're like, shoot, I haven't checked my email all day long, and now I've got to catch up there. But I try to, pick the kids up and let that go. We usually try to go to a park, or we go to the beach, which is as much for them as it is for me, because as a radiologist, you're in a dark room, so I'm like, I haven't seen sunlight all day.
Yeah, that's amazing.
And so it kind of helps me reset.
Sure.
And I don't work on weekends. I mean, they're very, seldom I'll have an exception to that, but I try to keep my weekends completely just for family. Okay. So I try to keep that balance the best I can. But
that's really good.
As you know, it's not always easy.
It's not always easy. Sometimes one piece of life seeps into another, but it's really good. Like the common thread that I keep hearing with anyone who is balancing is boundaries. The boundaries is so critical.
Yeah.
Just setting those up and making sure you adhere to them, and that everyone kind of on your team or people you work with understand that, and that you are following them and you're not wavering. Because it's like you want to help everyone, and you want to be there for everyone, but at the same time, if you kind of don't have that boundary up, then...
And people will take advantage. Like you'll have the text messages and the calls when you're like trying to do bedtime, and you're like, hey, I'm not going to... curbside look at this MRI for you. It's like 7:30. I'm reading books, and so you kind of have to keep that up, and we try to do that in the company in general. Like I try to never bother my staff on the weekends. Again, there have been exceptions, but I try to, because they all have families too, and that's the whole culture of the company, and all of my radiologists have families, and so we try to be very respectful of each other in our quite off hours.
That's good. Same with us. Like I don't think I hardly ever bother my team on the weekends. You always want to build that culture, and for them to feel like they're important and vital to your team, but again, that their boundaries are being respected, so that your boundaries can be respected. It's all a nice cohesive unit.
Yeah, and they have a life outside of work, like all of us. And it's just as important, if actually it's more important than work, because work's always going to be there, but you know, you got to spend time with the family.
Well, that's good.
Yeah.
Do you think, like, now that you've practiced medicine for a period of time, would you want your kids to go into medicine?
Oh, yeah. I'm trying to brainwash them hardcore.
Okay.
I'm like, I need someone to take over the business. So not only medicine, I'm like, you got to be a radiologist.
Okay, good. Do you see any kind of traits within them that you feel like would lend them to that practice area?
You know, my daughter is very artistic, and she's just got a natural eye she's very creative. Okay. So I'm not sure if she would love medicine, because it doesn't really lend itself to creativity.
Sure.
My son loves puzzles. Like he will sit there, and I mean, he just turned 5, but he'll do like 150-piece puzzle, and he just loves it. So he gets like locked in. So I could see him maybe liking radiology, because that is all you do. Like you just... You're opening up like an MRI, and you're like, okay, here's the problem. Let me solve this puzzle, you know.
Right.
And so I could see him maybe liking it. We'll see what my daughter wants to do. She wants to do a lot of things. Right now she wants to be a teacher.
Oh, that's nice.
She wants to be an artist. So you know, we'll see. She's very, very bright, but you know,
that's
of course,
awesome.
I love what I do, so I would very much support what they want to do, and
that's
hopefully
good.
Radiology.
Yeah, that's good. I'm glad to hear that, because like sometimes you'll hear the parents and they're a certain profession, and they're like, I never want them to do this ever.
Yeah.
And it's like, okay, you know, I want to know why that is. So
people get so burnt out in their profession, you know, and the reality is everything becomes mundane. And I think sometimes med students, you do these rotations your 3rd and 4th year, and you're like, oh my gosh, surgery is amazing. And it's like, well, it's amazing because this is the first time you're seeing it.
Yeah.
It's less amazing for that surgeon who's been practicing for 30 years and he's doing his I don't know, millionth gallbladder removal surgery. Right. And so you kind of have to start looking, I think, on the lifestyle of things. And that was what really dissuaded me from emergency medicine. In the very beginning, I was like, whoa, this is amazing. Yeah. It's like so fast paced and it's chaotic. And I'm like getting my hands dirty as a med student, and I'm doing like, I'm sewing people up and I'm draining abscesses and all of these things. And, but I realized after my 8 or 10 hour shift as a med student, I was exhausted. I was like, I didn't want to do anything.
Right.
And then I did a rotation in radiology, and I was doing from 7A to 7P, and so it was a 12-hour shift, and I was fine. Like I was a little tired mentally.
Sure.
But like physically, I was fine. I was like, okay, well, longevity-wise, I can do this forever. Like, I mean, you'll meet radiologists that just don't want to retire. They'll want to do it as long as they have the mental capacity to do it. And so it's not hard on your body because you're sitting a lot. But it's very, like, intellectually stimulating. So I think most radiologists, I mean, other than the way medicine has transitioned, like what they do. I think you'll talk to a lot of surgeons, and they'll all say, I wish I went to radiology. So it's a good field.
I love how, I mean, it's virtual. It's virtual before the world went virtual.
It's true. Yeah.
So, I mean, you can read from anywhere in the world, like you said, you know? Yeah. Which is awesome.
It is. Yeah, it is.
So kudos to you for finding that.
Yeah, thank you. Thank you.
What are some ways that you stay sane, you know, balancing motherhood, business, and physician life?
Yeah, I try to work out.
Okay.
So I think I told you this. So you and I both loved F45.
Yeah.
And unfortunately, I hurt my back deadlifting.
Oh,
yeah.
okay.
And I had to get my own MRI. And so I had to take a break for a few weeks. Finally, my husband's like, all right, babe. And he loves to work out. So he was, when I heard it from him saying, I think you need to rest, I heard it. Like everybody else, I was like, whatever. Yeah. And so I took a few weeks off, and I did nothing, and I was going nuts. Now I have built up to walking on the treadmill.
Oh, that's good. Good for you.
So, like, I try to do that, honestly, 5 days a week. So I'll try to go to the gym, usually drop off the kids, and I go right to the gym, and then I go right to work after that.
Right.
So that helps me a lot. The other thing that I just started this week, actually, and this was at the advice of my mom, is, and I know you felt this way, sometimes you feel like you're being pulled in every direction. Oh, yeah. And so I was trying to be a full-time neuroradiologist. I was trying to run Camelback Radiology. I was trying to run Camelback Imaging, you know, and try to be a wife and a mother. And and it can be a little exhausting. And you feel like you're not doing a good job at any of those things, but you're really strung out about it. And so my mom told me about, like, I can't remember who it was, but he would do his work in 4-hour blocks and put his phone on Do Not Disturb. And even if he got up to go to the bathroom, he would pause. So he would always getting the 4 hours done. And I was like, okay, I'm going to try that. And so I didn't do 4-hour blocks. I was doing 3-hour blocks because I usually leave about an hour in the middle of the day to do admin work, whether it's, you know, giving second opinions or doing consultations. Like, I always leave that open for my admin staff to fill it up with anything they need me to do. And it was amazing. Like, my productivity is, I've only done it for 1 week, so we'll see.
That's still good.
I mean, my productivity was great, and I was not stressed. Like, I didn't feel like, you know, like taking the deep breath after your day of work. And so I'm going to keep trying to do that because, you know, I've always been very available for everybody, but again, that comes at your own expense. And so I'm like, okay, there's really nothing that can't wait a few hours until I take my phone off Do Not Disturb and take my little break. And so I would say my best day that I had this week was I got up, I worked out, I did my 3-hour block. My 1 hour in the middle of the day got canceled, so I took like a 15-minute walk around the neighborhood. I did my next 3-hour block. I even had 10 minutes to do yoga at the end of the day. And I was like, I am mastering life right now.
Yeah, you feel like so fulfilled. You checked all the boxes.
I checked all, and it was great. And I got a lot done, and I felt good about it too. So
that's so important.
I would say exercise is the biggest one to keep me sane and keep me kind of aligned.
Right. I would so agree with that.
Yeah.
I feel like most of the time when I'm exercising, it's like the mental component. Like, I love, obviously, like the health component that comes with it.
Yeah.
But the mental component is so important. And if you don't, you feel that. You feel like a little antsy.
You do.
So.
Well, and I'd love to have F45 for that too, because you didn't have your phone. That's the only thing that kind of stinks right now is like I'm walking on the treadmill, so that means I'm still like connected to my phone. And F45, it was like, hey, I've got 45 minutes of like only just being right here, right now in the moment. So I'm hoping I'll get back to F45 by the end of the year. I will not deadlift as much as I was. I don't think I need to do that, but
it goes fast. I do recall, like, the movements were so fast.
So fast,
and the transition was so fast that, like, I probably didn't have the best form.
Probably not.
And it could have led to injury.
Exactly.
So, I'm with you. But that's awesome that you're still walking on the treadmill. I feel like you could still get your heart rate up.
For sure. At
an incline.
Yeah, exactly. You know? That's what I've been doing.
Yeah.
At an incline and, you know, getting a little sweaty. Not as sweaty as F45, but again, it's more just like that time to be active and
for sure.
And not sitting in front of the computer and stressed.
Yeah, that's really good and so important for anyone.
It is.
That's like got all the things to balance in life.
Yeah. Yeah.
You also are a huge traveler. Like, I
do love to travel.
your stories when you go somewhere.
you.
I'm like, I'm here for it. Front row seat, post everything. I'm going to live vicariously through you.
I appreciate that.
Where is a place that you've gone that you're just like, everyone has to go here? It's amazing.
There's probably two places that come to mind. So this past New Year's, Brian and I, my husband, went to Buenos Aires.
Ooh.
Loved that city.
Okay.
Loved it. I think sometimes when your expectations, like, you don't have any, like,
Right.
you just get blown away. And it's like the food was amazing. The cappuccinos were amazing.
Ooh.
The city was very clean. It was very walkable.
Okay.
We loved it. Like, absolutely loved it. And then we went to Patagonia afterwards. Again, just beautiful, beautiful scenery. And we went on both the Argentinian side and the Chilean side and just loved it. So that was, I highly recommend anybody going to Buenos Aires. Like, it was just incredible. And then the other one is, of course, Japan. Everybody loves Tokyo, and there's a reason. Like, it is, it's wonderful. Like, everybody in Japan, like, abides by, like, normal ethics, if that makes sense. Like, if you're getting on a train or a subway, people actually line up. And nobody tries to cut in line. Like, everybody's very respectful. It's like, you know, the best version of ourselves are all in Japan. Like, the food is incredible, and it's very clean. And, you know, I gauge a lot of places we travel by, like, would I feel safe here without my husband, or would I feel comfortable with my kids here? And I mean, Tokyo for sure. Like, I mean, it was just felt very safe. I wouldn't have been, like, you know, holding my kids' hands the whole time. Like, it, and very family friendly. I wouldn't have been, like, embarrassed to have kids there either. So I really, really liked both of those places.
That's awesome. Okay, so I'm gonna have to, like, put that on my bucket list.
I have a really, really good list of everything to do in Tokyo too. I kept good notes.
Okay, I want to go during cherry blossom season.
Yeah. Oh my gosh, those pictures are incredible.
I'm gonna have to hit you up for that list when I plan that trip. Where's your next trip? Have you planned it already? Or
we are going. So I turned the big 4-0 this year.
Oh my gosh.
I know. And
that's
so
a big milestone birthday.
I've always wanted to go to Greece, and like, I mean, for years, and it's always been like, well, let's go here instead, or oh, it's not a good time to go to Greece, and so we're going to go to Greece this year.
Oh my gosh.
We might go to Istanbul too, just because, you know, it's close, and it's like we've never been there, and I've heard such great things, and so that's our next trip that we have planned.
What's your opinion? You mentioned Istanbul. What's your opinion on people getting some of these cosmetic procedures done in Turkey?
You know, I don't have a strong opinion, but a lot of actual American physicians have gone themselves.
Okay.
And so I think the quality of care is probably pretty good. Like, I've seen a lot of people go to Mexico for procedures. I wouldn't necessarily recommend that, but I think probably the quality of care you're getting in Turkey is very good. The downside is when you have a surgical procedure somewhere else, you don't have your surgeon to follow up with.
Right.
And so I think that a lot of American physicians, that's their big gripe. They're like, great, this person went and had, you know, a facelift, and now they have an infection, and now I have to take care of them, and they weren't my patient. And so I think that's a little bit difficult, but I think probably the quality people are getting is probably good.
Okay, I've seen some people go down for hair transplants.
Yeah, exactly. There's like memes everywhere.
Yeah, I know. I'm like, oh my gosh, this is interesting. And the hospitality looks amazing.
Oh, it looks incredible.
Yeah.
I mean, I'm basing it completely off of stories that I've watched, but it does look amazing.
Yeah, my accounts are TikTok. Like, I don't know if that's like 100% accurate, but I'm watching these.
Yeah, exactly.
So.
I'm believing it. So.
Interesting. Awesome. Well, what are some of the goals that you have set for yourself, either personally or professionally, for the rest of 2025?
Gosh, I had a goal of running a mile every week, so that we might have to revisit once I can start running again. Pivot for that. Exactly. Yeah. I really want to start a research foundation, so I'll probably start that this year. A couple of my colleague radiologists also have an interest in research, and we do a lot in the traumatic brain injury world. And I feel like it's a very underdiagnosed condition, and I feel like there could be a lot more research in that realm. And we have a lot of patients that I think we could review their data. So I really would like to start my research foundation this year. I probably will have to bring on at least one, maybe not, or maybe two radiologists to join the team.
Wow.
So those are probably the two big professional things that I've got going on. Personally, you know, We'll see. I'd have to review my list. I write them down every year, so we'll see.
Your mood board, your vision board.
Exactly.
Talk a little bit about the TBI aspect.
Yeah.
Okay, so a lot of times, like as we are in injury law, I feel like a lot of adjusters are like, nope, there's no way they could have had a TBI in this accident.
I know.
What's your position on that?
So here's the big thing with TBI. The only way to diagnose it is with a neurologist or a concussion specialist, and that's the diagnosis. And it's only in our very specific field of medicine where we're having people challenge it. Like if you were an athlete and you were concussed and you saw a neurologist and they said you had a mild TBI, you had a mild TBI. That's the end of the story. In our industry that we're talking about, there's a lot of doubt. And it's like, oh, no, that's not true. Oh, the patient's lying. Oh, it's this. And so, but in reality, the more that we kind of diagnose and validate a patient's concerns and symptoms, there's actually been studies to show that they get better. Oh. And so when you doubt a patient, they don't usually improve because now they start to have like that that thought that something is wrong with me, and nobody believes me, and then it's like you're going down another path. But when you have any type of trauma and you have symptoms of a mild traumatic brain injury, and what's difficult is it's very vast. Like, I mean, it can be anything from, brain fog to headaches to difficulty sleeping, your loss of appetite. Like, it's just vast. It's a laundry list of symptoms that you could have. Right. When people are not necessarily believing you or validating you, you're kind of stuck with that. But once you have that diagnosis and you're like, okay, I'm going to get better, even if it's just simple as like hydration and good nutrition, because that's usually the first line thing for concussions or mild traumatic brain injury. Patients do really great. There's a lot of different, again, we'd have to bring in the neurologists on this side for the therapy. Right. But there's a lot of things that they're doing now with eye movement to kind of, reconnect those circuits in your brain. Imaging for mild traumatic brain injury only helps to help gauge what the outcome might be. Okay. Because we're not there to diagnose, and I think that's a big misconception. There's a lot of advanced techniques that they're trying to understand what's happening at the microscopic level. We do a lot with DTI, so that's an attempt to look at what's happening at the microscopic level. Okay. There's things called MR spectroscopy, which they're trying to see what's happening at that microscopic level. And again, it's only to help confirm the diagnosis or to help give a good prognosis, but it's not there to replace the neurologist. And I think that's probably the misconception because with the adjusters, they're like, well, the MRI of the brain is normal, so that means that the patient is fine, and that's not true. Honestly, most of the mild traumatic brain injury patients have a normal brain. So there's just a big misconception. And I mean, unfortunately, we know how the insurance world works in all insurances, and it's a business, and they don't make money by paying out claims, right? And so, there's nothing, they're not bad people, like they're just running a business. And so the adjusters are going to try to push back if they can. And, it just takes a wonderful attorney like yourself and a good team of physicians that are like, hey, actually, this is what's going on with this patient, and we need to make sure they're taken care of.
Right. I see it all the time.
All the time.
I mean, the adjuster's always pushing back. We actually have a mediation coming up on Thursday on this point. Yeah. Client has a TBI, and the adjuster's like, nope, that's not true. It didn't happen. I'm like, but she has memory loss. Yeah. As documented by the physician, and the TBI read shows.
Well, and it's funny, and correct me if I'm wrong, but the adjusters are not physicians.
No.
And so, they don't really have, their job is to push back on you. Their job is to try to tear apart your evidence, essentially, which is a lot of times the medical record that you're providing. Yep. And it's not until it goes to that next step that they'll start bringing in their own medical experts to evaluate. Because, in the beginning, you're just dealing with one level of person. Exactly.
One adjuster who thinks they're the lawyer, the doctor,
exactly.
the
Everything.
Judge, and the jury.
Exactly.
Like, wow,
exactly.
where'd you get that degree?
You're like, you are killing it.
You're really balancing life. No, I wanted to get your take on that because I feel like that's something that's important to hear from a physician's standpoint, not just an attorney's, obviously. So, you're caring about the client and them getting better. Yeah. We represent the client, and, hearing your take on it is really insightful. Yeah. So.
Yeah, and I mean, honestly, especially when you work with a good group of physicians, which I know you do, then what you're getting is factual. Like you're not really working with anybody that's trying to just make you happy. Like you're working with people that are giving you like, this is what's going on. And Sometimes it may not be what anybody wants to hear, but if you don't have any of the quote evidence, which again is the medical documentation, then that's all you have. And you've got to work with it.
Yep.
With the limited evidence.
Very true. Very true. Well, awesome. Thanks for your insight on that.
Of course.
Where can people find you?
So on Instagram, we have Camelback Radiology, and then I've got my website, camelbackradiology.com, and then camelbackimaging.com. So they can go on there, they can follow us, they can message us through the website, and it's probably the best way.
That's great. Thank you so much for coming on.
Yeah, of course.
I love that we know each other personally, and I've seen your practice grow, and you grow.
And right back at you.
And it's so awesome seeing a woman kill it. So kudos to you.
Thank you very much.
Thank you. Thank you for tuning in to Talk Legal to Me. Remember, you can listen to us everywhere you get your podcasts, including Spotify and Apple. And if you want to watch along, visit my YouTube channel at Lawyer Gordi. Until next time, stay informed, stay legal, and stay fabulous, besties.